I mean, one of the things that always amazes me is that we focus so much on the deficit. I understand that's the topic of the day, but it is kind of incredible here because we're sitting around with 25 million people unemployed, underemployed, or out of the labor force altogether. That's because we had a huge housing bubble that collapsed and wrecked the economy. And that's also why we have a really big deficit today. We didn't just go on a crazy spending spree. Obama didn't just go, okay, now I got the keys to the White House, I'm going to go out and spend like crazy. The economy collapsed. And that's easy to show. That's why we have a huge deficit today. Now again, Senator Simpson and Dave were exactly right. We did things in the last decade under President Bush. We had wars that we did not pay for. We had large tax cuts that added to the deficit. And also the Medicare drug benefit, which was both not paid for and done in a way that meant a lot of money to the insurance and the drug industry. It could have been done much, much more efficiently. These are all true. But let me make one other point on that. When, again, Dave was talking about how we got surpluses at the end of the decade. Important to realize, I was just looking at this by chance earlier this afternoon. I didn't plan this, but I was looking at it for another reason. In 1996, the Congressional Budget Office projected that we would have a deficit of $240 billion in the year 2000. At that time, that'd be about 2.7, 2.8% of GDP. It'd be the equivalent of about, say, $420 billion today, today's economy. Well, we ended up, of course, with a surplus in the year 2000, about $240 billion. Why was that? We didn't have any big tax increases in the late 90s, at least not that I can recall. We really didn't have any big spending cuts. What happened? Well, the economy grew a lot more than anyone expected. The Congressional Budget Office thought the unemployment rate in the year 2000 would be 6%. Turned out to be 4%. That was the biggest story, the biggest part of the difference between a deficit of, in today's dollars, somewhere around $400 billion, and instead a surplus of $400 billion. Point being, the economy has to be front and center. Now again, Senator Simpson's exactly right. If you look at the healthcare projections, we cannot grow our way out of it. The healthcare projections are absolutely crazy, and it's not Medicare and Medicaid, it's healthcare in general. So it's not that we have these government programs that are uniquely bad and the private sector is just fine. In fact, it's just the opposite. So I thought Representative Ryan did a very useful thing with his proposal last week, because he put out a concrete proposal. He said, we're going to give everyone a voucher. He likes to use the term premium support. I don't care. Use whatever term you want. You'll get a check of $8,000, 2022, everyone who gets on Medicare after that, and then you go buy it on your own. So our Congressional Budget Office costed this out, and they said, well, what does this look like? Well, it saves the government about $4 trillion over Medicare's 75-year planning horizon. So it saves $4 trillion that is passed along to seniors. Okay, but those aren't part of the story. They also project out what the cost would be to seniors of buying Medicare equivalent policies. Well, we added that up, and it comes to an additional $34 trillion. That's in addition to the $4 trillion of transfer. $34 trillion, that's a huge number. That will come to about $110,000 for every person in the country. That's pure waste. That's an additional payment to the insurance industry, to the doctors, to the hospitals, to the drug companies. That's pure waste as a result of going the route of the Ryan plan, turning it over to the private sector, which emphasizes my point. The problem is not Medicare and Medicaid, the problem is health care. So if we go the route that Representative Ryan wants us to go, we can go, great, we're going to turn it over to seniors, but all of us, well, I guess the seniors today will be okay, but when I turn 65, I'm not going to be able to afford health care, nor will just about anyone else, because it's going to cost more than their entire income if those projections prove correct. Now again, Senator Simpson's exactly right. You go and try and cut it, doctors will yell and scream. Drug companies will yell and scream. One of the things I love to point out, we spend about $300 billion a year on prescription drugs. It's about 2% of GDP. It's about $1,000 for every person in the country. It's real money. Suppose we got rid of patent protection. We let everything be sold at Walmart as generics. It costs us around $30 billion a year. 1/10 as much. We would save about $270 billion a year. We have an incredibly backward way of supporting prescription drug research. Raise this around any member of Congress, they'll go running and screaming because they know pharma would probably get their guns out and chase them out of town. Okay, but that's the sort of thing you have to talk about. Let me just mention one other thing I love to raise, and I always have a good time with this because I debate a lot of conservatives and they're all for individual choice in the market and everything. So I say, okay, Representative Ryan wanted vouchers. I wrote a little column about this after he came out with this money. He wants vouchers in Medicare. I go, I want vouchers in Medicare too. But I want to take it a little different form. He wants the voucher, you go to Aetna or whatever insurance company, you get your insurance through there. I go, well, I was talking a moment ago about we have all these other healthcare systems that are so much more efficient than those in the United States. We all want to be free traders, right? Okay, let people buy into the healthcare system of Germany, of France, of Canada, you know, and we'll split the savings, which end up being enormous. So we'll tell everyone on Medicare, you can stay in the existing program if you like. Well, we're going to give you a voucher, we'll negotiate the deal with the country, so they don't have to do it individually, we'll negotiate deals with Canada, Germany. You get to go to the country, you put $15,000 a year in your pocket, because that's what you're talking about once you get around 30, 40 years, and it's huge sums of money. And, you know, they're responsible for your care. So you can either move to that country and, you know, you'll have that money to put in your pocket and you're covered by them, or if you want, you can stay in the United States, pay for your out-of-pocket expenses from, you know, that $15,000 check you get every year, and if there's something serious, you go there and have them take care of you. Now, I raise that with, you know, people at Heritage and Cato, and invariably they get mad, and I always love to say, what's wrong with giving people a choice? Now, I originally proposed that as a joke, but I started, after thinking about it for a while, I thought, why not? What's the downside? I say this in all seriousness, what's the downside? You'll give people a choice, they'll save money, and my reason for saying this is twofold. One is you hear a lot of people circulating stories that we're the only ones that get care. You know, if you're in Canada and you know you have cancer, you're gonna have to wait 10 years till after you're dead. You know, it's nonsense stories, but people are hearing that. So let people vote with their feet and tell their friends and relatives, no, I've been in Canada and they treat me just fine, because I think most of them would end up saying that. So one is you get people experiencing that. Two, something just, you know, being purely pragmatic, you go, well, how do you change an industry that really perhaps needs to be changed, that is difficult to change? And here I will say something, I hope there's none of my friends from United Auto Workers here.
No, in Charlottesville.
No, I figured we're safer. Okay, GM, Ford, and Chrysler, they probably had to change some of the ways they do business. What ultimately led them to change? Foreign competition. Okay, so if we can't figure out how to fix our healthcare system because the interest groups here, the doctors, the drug companies, the insurance companies, they're too powerful, let's use foreign competition as a club. So that's my proposal.
All right, Dean has raised the Paul Ryan proposal, which obviously is getting enormous reaction, and you know, it's getting cheers and brickbats, depending on who's showing up at any given